Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 Homeopathic Remedies for Diabetes. What is diabetes mellitus, DM? Diabetes is a disease with error in metabolism, where lack of a particular hormone or due to obstacle in its proper functioning, metabolism of glucose is impaired, whereby the amount of glucose is increased in the blood abnormally, leading to severe and extensive damage to various organs of the body, and last, the affected person may die. What is the cause of diabetes mellitus? DM. DM means whenever DM will use, it is diabetes mellitus in this video. Lack of insulin, the main hormone that helps in the metabolism of glucose or obstacle to its normal functioning, is the cause of DM. Insulin is secreted from the beta cells of islets of Langerhans situated towards the tail of pancreas. Note the figure. This is pancreas. The tail of pancreas is this area. In this tail of pancreas, there are beta cells. It is written here, beta cells of Langerhans, and that beta cells of Langerhans excrete this particular hormone, which helps to simply burn out the sugar and produce energy. In its absence, the sugar cannot burn and the amount of sugar increased, thereby causing diabetes mellitus. What is the incidence of diabetes mellitus in India and Bangladesh? According to report of World Health Organization, diabetes mellitus has reached epidemic level in both countries, especially in India. Number of diabetes in India about 7 crores according to 2015. Now 2022. I do not know what is the present figure. This figure is collected from the internet. Number of diabetes in Bangladesh about 1 crore 2018. What are the types of diabetes mellitus? Main types are three: type 1, type 2, gestational. What is type 1 diabetes? It is an autoimmune disease where immune cells of the body attack and destroy beta cells of the islets of Langerhans of pancreas. So there is little insulin in the body of the affected person. Cause: hereditary, environment, either heredity or environment. Children are affected most. They cannot do without artificial insulin. This disease is incurable. Mind this is not treatable, neither manageable, very difficult, because here autoimmune system, the autoimmune disease means that immune system of the particular person are destroying the cells which are supposed to produce beta cells, islets of which is supposed to produce this insulin. They are destroying the beta cell of islets of Langerhans. The autoimmune cells are destroying the beta cells. That is, the person's own cells are acting against him, causing diabetes. This is type 1 diabetes. This is incurable, completely beyond control. This type of patient possibly do not live long. What is type 2 diabetes? Pancreas is working right. Insulin is there in the body, but glucose cannot enter into the cells due to lack of sensitivity of insulin receptors. That is, insulin receptors, these are insulin receptors, these white are glucose. This is normal cell. In normal cell, this insulin receptor are entering into the cell and glucose is burnt. But in case of type 2 diabetes, due to lack of the receptors, these are unable to go inside the cell and there is no burning of glucose, and this situation gives rise to type 2 diabetes. Cause: hereditary or erroneous lifestyle, either hereditary trouble or erroneous lifestyle. This is fully manageable. 55% of the elderly diabetics suffer from type 2 diabetes. Generally, type 2 diabetes means type 2 diabetes. What is gestational diabetes? During pregnancy, many ladies suffer from diabetes. This is called gestational diabetes. Lady with senior pregnant ladies, they generally suffer from this type of diabetes. In India, every year about 10 lakhs of women suffer from this trouble. At the end of the gestation period, this disease ends spontaneously. That is, the disease automatically die out. But those who suffer from this problem during pregnancy fall prey to type 2 diabetes later. Generally, they become a patient of type 2 diabetes later on. Gestational diabetes can harm developing fetus. The developing fetus is in danger position in case of gestational diabetes. In India, in all hospital nursing home, maintain a fixed protocol of treatment in this regard. This is a fixed protocol. All ladies under this obstetrics department where these pregnant ladies are being treated, they are under routine checkup, and is maintained a standard protocol is maintained for this treatment. What are the symptoms of diabetes mellitus? Number 1, polydipsia, huge thirst, polyphagia, huge appetite, polyuria, huge urine are basic trio symptoms. Unexplained weight loss, presence of ketone bodies in the urine, profound tiredness, irritability, fuzzy vision, wounds resist healing, easy skin infection. These are the common symptoms of diabetes mellitus. Who are predisposed to diabetes mellitus? Members of a family with predecessors as diabetes, obese persons who lead sedentary lives, racial factors, seniors, persons with a high BP, person with abnormal high level of triglyceride and cholesterol. Few related images are given. Just look. What is the limit of blood sugar in dwellers of Indian subcontinent? Non-diabetic, the standard that what should be. In case of non-diabetic, fasting should be less than 100 mg% and PP should be less than 140 mg%. That is, in 100 ml blood, 140 mg. In 100 ml blood, 100 mg milligram. Pre-diabetic, fasting between 100 125. This is fasting. And postprandial, that is after taking food, 140 190 90 mg%. Diabetic, fasting greater than 126 mg%, postprandial greater than 200 mg%. These are the standard for dwellers of Indian subcontinent. Mind this is not fixed all over the world. According to area, these have been designed. How can blood sugar be measured at home? See, this is the simple technique, invasive procedure for measuring blood sugar. And just with the help of a pin, just a penetration of the finger end is made. A drop of blood comes. It touches the sensitive. This is sensors fitted with the body. It touches. It should be touched in the sensor. The sensor will give the figure. This is one type. This is called invasive because there is penetration and coming out of blood. This is non-invasive procedure for measuring blood sugar. This is some extraordinary things. In this case, just touching of finger give the figure with the instrument. That is called non-invasive. There is no pricking of blood, pricking of finger, blood, etc. Why is diabetes called a malignant malady? Diabetes, that is excess amount of glucose in blood, increases the viscosity of blood. Further, presence of excess glucose in blood invites infection. As a result, following diseases occur easily: coronary heart disease like angina pectoris, heart attack; cerebral stroke; nervous disease like virulent foot ulcer leading to amputation of leg, foot; erectile dysfunction; dementia, Alzheimer's, depression, etc. Kidney failure; eye diseases like cataract, glaucoma, even blindness; skin diseases like carbuncles, etc. and damage of ear. Also sometimes due to virulent foot ulcer or already given amputation. So these are so many type of disease, and most of the diseases can bring about death of particular subject. So it is malignant malady. These are some picture is given. This is eye picture. In eye there is definite symptom of high level of blood sugar. With the help of the eye specialist, with the help of ophthalmologist, ophthalmoscope, they can see this, and this is a very nice test to know that the person is suffering from diabetes without any blood test, any other test, simple test, ophthalmoscope, seeing the interior of the eye. This gives clear indication that the patient is suffering from diabetes mellitus. There is foot ulcer, there is stroke, there is heart trouble. How to prevent diabetes mellitus? How to prevent? Yes, it is possible. Number one, maintain healthy food habits. Consume salt, sugar, saturated fat, bottle, canned foods and drinks, fine carbohydrate, meat, etc. as less as possible. All these as less as possible. Take fresh food, veggies, fishes, eggs, milk daily. Number two, control your body weight. Number three, practice physical culture daily. Number four, avoid addiction completely. Number five, keep mental stress under control. Number six, get at least 7 hours of solid sleep. Mind this physical culture daily, one thing is missing. This physical culture, you may simply walk, you may simply slow run or jog, whatever you can do, but the condition is that there must be a few drops of sweat come out of that physical culture. That is a critical, that is a very, very important point. Please mind it. Diabetes for urgentum met. That is, in which case urgentum met should be given. Copious, sweet smelling, turbid, whey-like urine at night. Travels more at night, has to wake several times. Great emaciation, weakness, face sunken, pale, sallow, scrotum and feet edematous, itchy, tend to attract gangrene. This is urgentum met. Diabetes for bovista. Even after urination, desire to urinate again. Emission of just few drops. Urine bright red or yellow green. Bright yellow becomes turbid slowly on standing. Violent sediment. General languor, particularly about joints. Sensation as if heart were working in water. Visible palpitation after exertion. Backache with stiffness, urticaria. Mind, this is very exceptional symptom. Sensation as if heart were working in water. Heart working in water. This feeling belongs to the person himself. Nobody, no doctor, nobody else can feel it. If this is reported by some patient to doctor, then bovista is the medicine. You need not consult any other symptom. This symptom is sufficient. Diabetes for calcarea force. Diabetes mellitus with lung implications. Diminishing quantity of urine, lowering of specific gravity. This is a USP, means uncommon, strange, peculiar symptom. Diminishing quantity of urine and lowering of specific gravity. Generally, the specific gravity should be increased in case of diabetic patient, but in case of sometimes it is going low with quantity of urine also low. This means you give him calcarea force. After urination, sore aching feeling in bladder, involuntary sighing, chronic cough of conjunctive insecure tubercular some disease, some patient who suffer from cold feet, copious perspiration with TB. Diabetes for calamure. Diabetes with stomach and liver troubles. Itching in urethra with excessive and sugary urine. Urine may be milky white with lumpy discharge of white thick mucus. Constant dribbling of urine due to cystitis, inflammation of the bladder, urinary bladder. Pains in kidney. Profound weakness with drowsiness. Diabetes for lac fluid. Severe aching in back. Urine voided in huge quantity with severe lassitude weakness, intense throbbing, headache in forehead with nausea, vomiting and constipation. diabetes for phosphoric acid. Neurogenic diabetes. This diabetes is not normal diabetes. It is neurogenic from nervous cause, from grief, sorrow, anguish. That is, the patient was okay, but after receiving severe sorrow, his diabetes starts. In that case, phosphoric acid comes. Pain in back and kidneys, dull pressure in bladder, urine thick like milk, it's called child urea, containing high sugar. All joints feel bruised, excessive falling of hair, weakening of vision, excessive thrust, hard difficult stool, shortness of breath. Diabetes for acid sulfuric. Urine contains high amount of sugar, itching over whole body, flatulency, upward and downward, stitches in hepatic region, hepatic means liver, lassitude, very much weakness, debility, despondency with dimness of sight, worse in open air, cold from alcohol, from odor of coffee. These are the aggravating factors. Open air, cold, alcohol, coffee. Better from warmth and hot drinks. Ameliorating factor. Diabetes is oxidase. Diabetes from long suppressed gonorrhea. The gonorrhea suppressed, diabetes starts. Urine on standing shows a brownish mucus. Debility worse in morning, desire to urinate day and night. Longs for cold food and drinks. Longings alternate with lack of appetite. Diabetes for plumber met. Urine copious but flows slowly, drop by drop. Dryness of mouth, dry cracked tongue, fever with unquenchable thirst, great hunger, emaciation, exertion in impotence, obstinate belching and vomiting with stubborn constipation, stool like hard black balls like sheep tongue. Note the tongue, peculiar tongue of plumber met. Diabetes for phosphorus. Diabetes with tuberculosis, cheesy degeneration of lungs, pale profuse watery urine, turbid like curdled milk with brick dust sediment. Subject with gouty diathesis, suffering from cerebral diseases, anxious, fears being alone at twilight, fears of ghost, thunderstorm, timid, irresolute, apathy to own children with exaggerated idea of their importance.